Hello, good morning, good afternoon, good evening. This is East Doctors TV with me, Opionethan Insobuga. Today we're going to look at a condition called nose bleeding. In a medical language, it is called epistaxis, which is nose bleeding. We have very many medical conditions, but I think I've got an idea. I will be discussing those that my friends, our patients will be asking. So I have a friend who was asking about nose bleeding. What could be the cause? What can I do? So nose bleeding is common, especially in children, even adults. Like we can also get nose bleeding. So nose bleeding, it is when you see blood coming out of your nostrils. It is caused by many things. Number one, nose bleeding can be caused because of dry hair. The hair that we breathe in, the oxygen. Sometimes people who are living in very dry climates, for example, people who live, for example, in Uganda, the parts of northern and far east, when you're living in a very dry land, when the climate is so dry, you can experience nose bleeding. Also, people who live indoor. Indoor, we mean people from morning, the person is in the house, they do everything there, they cook from there, they are ironing, they use a lot. You know, the house develops a lot of heat inside. So the air that you're breathing in becomes too dry. Otherwise, the air we're supposed to breathe in, it has to be moist. As you see oxygen, there is some kind of that element of water. So the air we breathe in has to be a little moist. But when you take in dry air, you can easily cause those blood vessels inside of the nose to rupture, then you see blood coming out. Another cause, it could be trauma or injury. You know, I told you the nose, it is highly supplied with blood vessels, but those blood vessels are too many and too tight, and too small rather, tiny. And the inner lining of the nose, the inside lining, the membrane, it is soft, that mucosa lining, the inner layer of the nose, it is too soft that it can easily break and you see bleeding. So if anyone knocks you, a blow, a slap, a punch, or even if you knock yourself on the nose, you can easily bleed due to an injury or trauma. Another one is an allergy. People who get allergies, for example, people allergic maybe to, you know, cold weather, hot weather, and other causes of allergens. When you have an allergy, there is a possibility that you can easily get a nose bleeding, because these allergies come with sneezing. Remember, an allergy means there's something foreign in your body. So the body stimulates a reflex, what we call sneezing. You want to sneeze and bring out what is abnormal, or that what is foreign. So in that process, you can easily rupture those vessels and you see bleeding from the nose. Another cause could be infections. I told you last time that an infection means presence of disease-causing organisms in the body. So conditions like flu, what you call flu, for us we call it common cold or cold. It is caused by a virus, which virus, or those rhinoviruses, can also cause you to have a nose bleeding. Also, infections like sinusitis, what you can call sinuses, it can also bring you nose bleeding. What is important is to understand, doctor, if I have nose bleeding, or if I have my son, my daughter at home is bleeding, what can I do? It's not a medical emergency that you need to be on tension or panic because someone is bleeding. But however, it is something that you can do wrongly and you get difficulties and hardships or complications. I remember when we were children in the villages, they used to tell us when you have nose bleeding, you have to bend like this, the bleeding will stop. However, whatever we're doing was not right. What are you supposed to do? When you experience your bleeding, you have to hold, you see my hands here, you hold your nose, because you can either breathe in the nostril or in the mouth. So you close your nostril, then breathe in the mouth. Then what you do after closing, you bend it down. Just like 5 minutes. I think it will be done. You hold like this, then bend down. For about 5 minutes, the bleeding will stop, because in the blood, there is what we call clotting factors. So when you squeeze your nostrils, it will encourage the clotting factors. Eventually, the blood will stop. You can also use some drugs like aspirin. It is a blood thinner. It can help stop the bleeding. Or you can take even a painkiller like ibuprofen in case of pain. You'll be fine. This is what you can use at home, what we call home remedy. Thank you for watching. It's Doctors TV. I wish we meet again in the next videos. Thank you.